4 in 5 seniors believe the healthcare system has completely failed them, but what they don't realize is they're making critical mistakes that could be silently destroying their health right now. There's a hidden epidemic sweeping through America's aging population, and 99% of people over 60 have no idea they're caught in the middle of it. Every single day, millions of seniors unknowingly sabotage their own well-being through 5 devastating mistakes that their doctors never warned them about. Here's the shocking truth. A groundbreaking study from Johns Hopkins University revealed that nearly 800,000 Americans die or become permanently disabled each year, not from their diseases, but from preventable healthcare errors, and seniors are the most vulnerable targets. One mistake we'll cover today is so common that it affects 83% of people in their 60s and 70s, yet it's causing a staggering $50 billion in unnecessary healthcare costs annually. Another mistake is happening right inside your medicine cabinet, and it's triggering falls, memory loss, and even death at rates that would terrify you if you knew the real numbers. But here's what makes this even more disturbing. The healthcare system isn't just failing seniors, it's actively working against them through communication barriers, dangerous oversights, and a catastrophic lack of preparation for aging patients. Only 1 in 10 seniors give the healthcare system an A grade, and for good reason. The mistakes we're about to reveal aren't just inconveniences, they're life-threatening patterns that are stealing years from your life and quality from your remaining time. Before we begin, I have 2 critical questions for you. First, how many prescription medications are you currently taking? Second, when was the last time a healthcare provider actually listened to your concerns without rushing you out the door? Let us know in the comments below where you're watching from and your age. We're reading and replying to every single comment with personalized advice that could change your health trajectory. And don't forget to like this video and subscribe, because what you'll learn today isn't available anywhere else. Now, without any further delay, let's uncover the first mistake that's quietly devastating senior health across America. Mistake number 5, the polypharmacy trap that's turning your medicine cabinet into a ticking time bomb. Most seniors think more medications mean better health, but they're walking straight into one of the deadliest traps in modern medicine. Polypharmacy, which means taking 5 or more prescription drugs simultaneously, affects 1 in 3 adults over 60. And it's creating a cascade of dangerous interactions that doctors rarely catch until it's too late. Here's what happens inside your body when you're caught in the polypharmacy trap. Each medication you take doesn't just target one system, it affects multiple organs and processes throughout your entire body. When you combine 5, 6, 7, or even 10 different drugs, you're creating chemical reactions that no medical textbook has ever studied. The human body becomes a laboratory for untested drug combinations, and seniors are the unwilling test subjects. The Centers for Disease Control found that 83% of people in their 60s and 70s are taking at least 1 prescription drug, with 1/3 taking 5 or more. But here's the terrifying part. Inappropriate polypharmacy increases your risk of falls by 300%, triggers cognitive impairment that mimics dementia, and creates harmful drug interactions that can cause new diseases while you're trying to treat existing ones. Take Sarah, a 71-year-old retired teacher who came to us taking 12 different medications prescribed by 4 different specialists. She was experiencing dizziness, confusion, and constant fatigue that her doctors kept treating with additional medications. When we conducted a comprehensive medication review, we discovered that 3 of her drugs were causing the exact symptoms she was being treated for with 6 other drugs. Within 2 months of carefully reducing her medications under medical supervision, her energy returned, her mind cleared, and she felt 20 years younger. But the polypharmacy trap gets even more sinister through something called prescription cascade. This happens when doctors prescribe new medications to treat side effects caused by existing drugs, creating an endless spiral of chemical dependency. You start with 1 medication for blood pressure, develop ankle swelling as a side effect, get prescribed a water pill, which causes potassium deficiency, leading to another prescription, which affects your kidney function, requiring yet another medication. Before you know it, you're trapped in a web of chemical interactions that's impossible to untangle. The financial cost is staggering. Polypharmacy costs Medicare and Medicaid the $50 billion annually, but human cost is immeasurable. Seniors are experiencing medication-induced falls, cognitive decline, and organ damage that gets blamed on aging when it's actually caused by dangerous drug combinations. One of the most dangerous forms is CNS active polypharmacy, where seniors are prescribed 3 or more medications that affect the central nervous system. These include pain medications, anti-anxiety drugs, sleep aids, and antidepressants. When combined, they create a deadly cocktail that increases fall risk by 400%, causes respiratory depression, and can lead to accidental overdoses even when taken as prescribed. A recent study found that nearly 14% of seniors with dementia were prescribed these dangerous combinations, despite the fact that these medications can worsen cognitive function and increase the risk of death. The tragedy is that many of these seniors can't communicate when they're experiencing adverse effects, so the dangerous combinations continue unchecked. Here's what most doctors won't tell you. Many medications that were appropriate when you were younger become dangerous as you age. Your kidneys process drugs more slowly, your liver has reduced capacity, and your body composition changes, meaning drugs stay in your system longer and at higher concentrations. A medication dose that was safe at 60 can be toxic at 75. The solution isn't to stop taking necessary medications, but to conduct regular comprehensive medication reviews with a pharmacist or geriatric specialist who understands drug interactions in aging bodies. Every 6 months, every single medication should be evaluated for continued necessity, appropriate dosage, and potential interactions. But polypharmacy is just the beginning. The next mistake we're covering is happening in homes across America, and it's causing more than 2.8 million emergency room visits every year. Mistake number 4, the home safety blindness that's turning your sanctuary into a death trap. Your home, the place where you should feel safest, has quietly become one of the most dangerous environments for your health and survival. More than 1 in 4 seniors falls each year, and the shocking truth is that most of these falls happen in familiar surroundings where simple modifications could prevent devastating injuries. Here's what makes this mistake so insidious. Falls aren't random accidents. They're predictable events caused by hazards hiding in plain sight throughout your home. Every year, falls result in more than 800,000 hospitalizations and 27,000 deaths among seniors, with total costs exceeding $31 billion. But the real tragedy isn't the statistics. It's that up to 90% of these falls could be prevented with proper home safety modifications that most seniors never implement. The problem starts with lighting. As we age, our eyes need 3 times more light to see clearly, yet most seniors live in homes with inadequate illumination. Dark hallways, poorly lit staircases, and dim bathrooms create invisible obstacles that turn simple navigation into high-risk activities. One shadow cast by a coffee table can hide the edge that catches your foot and sends you crashing to the floor. But lighting is just the beginning. Look around your home right now. Are there loose rugs that create trip hazards? Electrical cords running across walking paths? Clutter that forces you to navigate around objects? Each of these represents a potential disaster waiting to happen. The bathroom is particularly treacherous, with slippery surfaces, hard edges, and no grab bars to provide support when you need it most. We had a patient named Robert, an 82-year-old former engineer who prided himself on his independence. He was living in the same house for 40 years and knew every corner, every step, every room by heart. But one morning, rushing to answer the phone in his dimly lit hallway, he tripped over a throw rug his wife had placed there decades earlier. The fall shattered his hip, led to surgery, months of rehabilitation, and ultimately forced him into assisted living. A $15 rubber backing under that rug could have saved his independence. The fear of falling creates its own dangerous cycle. Many seniors become so afraid of falling that they stop being active, which actually increases their fall risk by weakening muscles, reducing balance, and decreasing bone density. This fear-induced inactivity can lead to social isolation, depression, and a rapid decline in overall health that's far more dangerous than the original fall risk. What makes this mistake even more devastating is that most seniors never receive professional home safety evaluations. Occupational therapists and physical therapists are trained to identify fall hazards and recommend modifications. But Medicare and insurance companies rarely cover these assessments until after a fall has already occurred. It's a backwards system that waits for tragedy before providing prevention. The modifications needed aren't expensive or complicated. Installing grab bars in bathrooms costs less than $50, but can prevent injuries that cost hundreds of thousands in medical bills. Improving lighting throughout the house, securing loose rugs, and removing clutter from walkways are simple changes that create dramatic safety improvements. But here's what most people don't realize about fall prevention. It's not just about physical hazards, it's about medication effects, vision problems, and balance issues that compound the environmental risks. Some medications cause dizziness, confusion, or sudden drops in blood pressure that increase fall risk, regardless of how safe your home environment might be. The next mistake we're covering affects your ability to communicate with healthcare providers, and it's creating barriers that could literally be the difference between life and death. Mistake number 3, the communication breakdown that's making you invisible in your own healthcare. 1 in 3 seniors over 60 has hearing loss, yet most healthcare providers never adjust their communication style to accommodate this reality. What's happening in doctors' offices across America is a silent epidemic of miscommunication that's leading to misdiagnosed conditions, incorrect medication instructions, and treatment failures that could cost you your life. Here's the devastating truth about healthcare communication. In a massive survey of over 12,000 Medicare beneficiaries, 42% reported hearing problems, 26% had difficulty with written instructions, and 7% struggled with telephone communications. Yet healthcare systems continue operating as if every senior has perfect sensory abilities and cognitive processing speed. The result is a catastrophic breakdown in the most fundamental aspect of medical care, the ability to understand and be understood. But hearing loss is just the beginning of this communication nightmare. Healthcare providers routinely use medical jargon that would confuse a medical student, let alone a 75-year-old trying to understand their treatment options. Terms like idiopathic, contraindications, and comorbidities get thrown around in 15-minute appointments where seniors are expected to absorb complex information while feeling anxious, overwhelmed, and often physically uncomfortable. Even worse, many healthcare workers unconsciously slip into what researchers call elder speak, a patronizing communication style that treats seniors like children. They speak slower, use simpler words, and adopt an exaggerated tone that's not just insulting, it's dangerous. This condescending approach makes seniors feel disempowered and less likely to ask important questions or advocate for their needs. We witnessed this firsthand with Margaret, a 79-year-old retired librarian who was prescribed a complex medication regimen after a heart procedure. Her cardiologist rattled off instructions using medical terminology while she sat there nodding politely, too embarrassed to admit she didn't understand half of what he said. She left the hospital with no clear understanding of when to take her medications, what side effects to watch for, or when to call for help. 3 weeks later, she was back in the emergency room with dangerous drug interactions that could have been prevented with clear communication. The ageism embedded in healthcare communication goes deeper than most people realize. Studies show that doctors spend less time with older patients, interrupt them more frequently, and make treatment decisions based on stereotyped expectations rather than individual assessment. Younger patients receive more detailed explanations, more treatment options, and more collaborative decision-making. Seniors often get rushed through appointments with minimal explanation and are expected to comply without question. This communication crisis becomes life-threatening when seniors can't understand discharge instructions, medication labels, or warning signs that require immediate medical attention. Hospital readmission rates for seniors are partially driven by communication failures that leave patients confused about their care plans. When you can't understand what your doctor is telling you, how can you possibly follow their recommendations effectively? The technology gap makes everything worse. Healthcare systems are pushing seniors toward patient portals, electronic communications, and telemedicine platforms that many older adults struggle to navigate. A 73-year-old who has never used email is suddenly expected to check test results online, schedule appointments through apps, and participate in video consultations that require technical skills they've never developed. But the most dangerous aspect of this communication breakdown is that seniors often don't speak up when they're confused or concerned. Cultural conditioning teaches older adults to respect authority figures and not question medical professionals, even when something doesn't seem right. This deference can be deadly when symptoms get dismissed, concerns get minimized, or treatment plans aren't clearly understood. The solution requires both sides of the equation to change. Seniors need to become more assertive advocates for their own care, asking questions, requesting written instructions, and bringing family members to important appointments. But healthcare providers must also learn to communicate effectively with older adults, which means speaking clearly, checking for understanding, avoiding jargon, and treating seniors with the respect and dignity they deserve. Now we're about to reveal mistake number 2, and it's happening inside your body right now, slowly stealing your strength, your energy, and your independence. Most seniors have no idea they're experiencing this silent crisis, but it's affecting 1 in 4 older adults and contributing to falls, cognitive decline, and early death. Mistake number 2, the hidden malnutrition crisis that's starving your body from the inside out. 25% of American seniors are malnourished or at serious risk for malnutrition. Yet this devastating condition flies completely under the radar of most healthcare providers and families. This isn't about not having enough food. It's about your aging body's changing ability to absorb, process, and utilize the nutrients it desperately needs to maintain health and function. So there you have it. 5 critical mistakes that are quietly destroying senior health across America. From the polypharmacy trap turning medicine cabinets into time bombs, to home safety blindness creating death traps in familiar spaces, to communication breakdowns making seniors invisible in their own health care, to the hidden malnutrition crisis starving bodies from within. These aren't just statistics, they're preventable tragedies happening right now. Your health after 60 isn't about luck, it's about knowledge and action. Share this video with someone you care about because awareness is the first step toward reclaiming your golden years. Thanks for watching.